Prescription writing for a patient with peptic ulcer. First, here is the scenario. A 30 years old female is suffering from epigastric pain that is somewhat relieved by eating and bloating since last 2 months along with frequent nausea and loss of appetite. She also complains of repeated episodes of vomiting and diarrhea. During lab investigations, H. pylori antigen was found in the stool. Diagnose and treat the patient. Now, the first step is to diagnose. On the basis of symptoms, we can confidently say that she is suffering from gastritis and peptic ulcer disease. Investigations tell us that H. pylori was found, so we can confidently say that the patient has peptic ulcer disease that is being caused by H. pylori. Once we have made the diagnosis, we must define the therapeutic objectives. The therapeutic objective is to eradicate H. pylori infection. To do that, now we must think of the list of drugs that are needed. The list of drug groups that are used include proton pump inhibitors, H2 receptor blockers, antibiotics, antidiarrheal. We can use any one of these and we can use a combination of these drugs. So this is how we write a prescription. On the prescription, on the upper right hand corner is the doctor's name, qualification details, clinic address and contact number. On the left hand side, we write the patient's name, their age, gender, address and the date. Then we write in detail the presenting complaints. This patient had epigastric pain since 2 months, bloating, nausea and vomiting, loss of appetite and diarrhea. All these symptoms points towards peptic ulcer disease, which we write as our diagnosis. Now, the treatment that we have decided for this patient includes tablet omeprazole 20 mg per oral twice daily. Omeprazole is a proton pump inhibitor that helps to raise the gastric pH and which allows the gastric mucosa to heal, and it also helps in eradicating H. pylori. Next, we have tablet clarithromycin 500 mg per oral twice daily. Clarithromycin is the antibiotic that will help us eradicate the H. pylori infection. Then another antibiotic is added to prevent resistance and ensure eradication, and that antibiotic is tablet amoxicillin 1 gram per oral BD. For patients that may be allergic to penicillins, we can replace amoxicillin with metronidazole. We can add tablet metronidazole 500 mg per oral BD in place of amoxicillin. The fourth drug is tablet bismuth salicylate 1 gram per oral BD. This is used to prevent diarrhea, help in the eradication of H. pylori infection, and it also helps to heal the gastric mucosa. We give the antibiotics and proton pump inhibitors for 14 days, and we write them down clearly on the prescription. Then we write the investigations. The investigation that is recommended for such a patient is analysis for the occult blood in stool. We suggest this investigation to the patient on the prescription, and then the doctor signs his name and writes his PMDC number. And this is how we write the prescription for a patient with peptic ulcer.